actives are feeling the heavy hand of censorship in the United States and across Western Europe. Their social media accounts are being banned, blocked, and canceled on Twitter, YouTube, and Facebook, often over criticism of Islam or immigration. British anti-Islamization activist Tommy Robinson has had his Twitter account suspended again after he tweeted that Islam promotes killing. A German activist received a 6-month suspended jail sentence for calling Islam a fascist ideology. A 65-year-old Swedish woman faced charges for saying immigration from the Third World will lead to low IQs. She was only cleared because authorities couldn't prove it was her. 2 weeks ago, 3 conservative activists were refused entry into Britain because Britain's border police said they were likely to incite tensions between local communities in the United Kingdom. One was interrogated as a terrorist and was asked if she was a, quote, Christian extremist.
You read stories about Prager University, their videos. You hear the story about the throttling of conservatives, demonetization on YouTube, the issues on Google and Facebook. Right. Well, how about spending some time censoring jihadis online if you're a big social media company, as opposed to targeting conservatives? That would be a real reprioritization that could save lives.
The so-called digital frontier is getting fenced in. It's not quite as broad as we were told it would be. A handful of companies now have almost total control over what we can say, do, or see on the internet, control of almost all human information. Consider Facebook. About half the country uses it as a primary news source. Millions and millions of people understand the world through Facebook. But Facebook is not a neutral host. It has a political agenda. Earlier this year, Facebook altered its algorithms for what news stories its users see, and the results, conclusively, have been devastating for conservatives online. Breitbart, the news site, has basically lost about 30% of its traffic since that happened. PragerU down 32%. Daily Caller is down. Rare closed its doors. Some reports say IJR is on the brink of collapse. Meanwhile, purveyors of approved elite opinion, CNN, the New York Times, the Washington Post, they've been unaffected by this. What is this? Well, it's an act of ideological warfare, and it's far more worrying than anything that Cambridge Analytica has done or is accused of doing. Floyd Brown founded WesternJournal.com, as another site hit big by the changes at Facebook, and he joins us tonight. Floyd, this is not just a fever dream on the right that Facebook is somehow singling out, in effect, conservative sites. The numbers are really clear. How is this working?
Well, it's very clear, and I would say that Facebook has broken its trust with the end user. You know, one of the things I always liked about Facebook and admired about Facebook was that it was optimized to the end user. You have about 1.5 million followers on Facebook, Tucker, and the truth is as one of those followers, I expect to get news and information that you find interesting and you decide to share.
Right.
That's a social network. It's no longer a social network when Mark Zuckerberg and the other elites in Silicon Valley decide what you should get, the information that you should consume, and really decide from on high what news you should have.
How do we get to a place where one company, or along with Google, really 2 companies, control all online media, both political companies, and without any oversight at all by anybody, can just shut down sites they disagree with? How did we get to that place?
Well, I think that early on, Facebook did a fabulous job of letting people basically curate their own content. We all went online and we liked different people. We followed Donald Trump. We followed, people in the news that we liked. We followed publications that we liked. And so we were all of a sudden getting, great content that we all wanted to follow it and consume it. And so as a result of that, Facebook went through the roof. But now Facebook's having trouble with engagement because it's not optimized to the end user anymore. It's now optimized to the thought police. And that's a big change that's really, it's hurting Facebook, but it's also hurting discourse in America. And it also, Tucker, and this is, I think, what people need to understand on Capitol Hill, is it has big implications for upcoming elections and really the ability of America to make good decisions.
If you were on Google yesterday, you may not have noticed anything anything, but that's the problem, right?
That's right. You know those fun little Google Doodles that they have on Google to celebrate certain holidays? Where there was not one to celebrate Easter, and some Christians are upset about it. InfoWars editor-at-large Paul Joseph Watson pointed it out, saying, so Google has a doodle for every obscure woke person or event imaginable, but nothing for Easter. Matthew then chimed in, saying, speaks volumes on how Google sees Christianity. And Joe says, so glad I don't use Google, nor will I ever. Hashtag boycott Google. Must be hard not using Google, but the company does say that they don't use any religious imagery on any of their Google Doodles, so it is not just Easter. And they did tweet about Easter, so that's how they celebrated the holiday.
But don't they for Christmas? I mean, isn't that?
I guess they use, you know, Santa Claus and things like that,
right.
but no, Jesus imagery.
The federal government is warning Americans about what's being called nightmare bacteria. The CDC says the organisms have now been found in 27 states, and antibiotics can't kill them. Officials say a network of experts was developed last year to help identify the potentially deadly bacteria, but they want more doctors to take part. They say 23,000 Americans die every year from bacteria that's resistant to antibiotics.
Chief Medical Correspondent Dr. John LaPook is here with more now. John, it sounds frightening. What are nightmare bacteria, what they're calling?
Jeff, these are bacteria that are resistant to most, if not all, antibiotics. And that's happened because we overuse these antibiotics. Now, the CDC is using the term nightmare to refer to a certain kind of bacteria called CRE because the death rate from infection can be as high as 50%.
That is high. How and where do they find this bacteria?
For the first time in 2017, there was a nationwide survey, and they found that infections from these kinds of bacteria were more common than expected. 221 cases with infections in places like the bloodstream, the lungs, and the urinary tract.
And so what is the CDC saying should be done about nightmare bacteria?
Well, lots of ideas. There's one really big, interesting idea, and it's what amounts to infectious diseases SWAT teams. So if there's an infection, they bring everybody together, the doctor, the patient, nurses, lab personnel, public health people, and they do things like isolating the patient, making sure people wash their hands properly. So simple, so important. And then something that's not intuitively obvious, testing contacts of people who seem to be fine. They're a contact of somebody who's infected, and maybe they themselves are harboring the infection and yet not showing signs yet. These have all been shown to be very effective.
And interesting, you also think antibiotics are often way overused.
Way overused. For example, patients come in, they have a cold that's caused by a virus. They're not treatable by antibiotics. Don't ask your doctor for it, and the doctor shouldn't prescribe.
So we are learning what is the extent of the problem and how to best manage it, and that's so critical.
Dr. Sitha Lakshmi is an infectious disease specialist at Tampa General Hospital. She says new research and better communication between local partners and state and federal agencies will help address the crisis.
If you're the frontline provider, how do you act on this issue? What are your resources? How can you prevent this from spreading to other places, other people?
And identifying specific strains of nightmare bacteria will help healthcare providers respond aggressively, as the CDC pointed out in a conference call today.
The containment strategy can reduce the number of nightmare bacteria cases by 76%.
Dr. Lakshmi says local hospitals now limit widespread use of antibiotics, which keeps bugs from mutating as rapidly.
You take it only if you need it. Don't take it just when you have a runny nose cold with the virus.
And other practices like frequent hand washing can also help.
It took a lot of strength and courage for Alanis Garcia to get where she is today.
That person I was up on the stage earlier today, that's not thing I would have ever been able to do back when I was him.
Alanis says for years she felt the life she lived wasn't an authentic representation of her identity. After struggling internally for a long time, she made the decision to come out as transgender in 2013.
I think I was more surprised about the people who accepted me than the people who didn't.
After the announcement, Alanis began the work of shaping an identity that reflected who she was.
I didn't feel like I had to hide anymore. I felt more able to talk to myself.
And talk to others. That's what she did today at the Transgender Visibility Rally in Centennial Park in Fort Myers. Alanis joined countless other voices from Southwest Florida who came together to highlight issues affecting the transgender community, both locally and nationwide.
Visibility is important because we need to make sure that our community is loud and proud of who they are.
Ezra Galen is a community organizer who helped bring the event together. Ezra tells me events like these will help people who are struggling speak out instead of staying silent.
You know, even if you're afraid, it's okay. You've got allies. You've got people that are sitting with you and will stand beside you.
We want equality. We want to have the same hopes and dreams that everyone else has in America. We want the same kindness, dignity, and respect that all people expect to get.
Local activists also kicked off the event speaking about ways to increase visibility for the transgender community.
When my name was called, I walked to a small desk, presented my documents to a human resource person, and upon examining my documents, the human resource person asked me why my genders did not match. After disclosure of my transgender identity, my co-workers refused to speak to me. I was referred to as the freak.
What we're really focusing on are the practical implications of what happens when you show up for a new job or you show up to sign up for housing or some kind of benefit and your gender markers do not match, and then you're refused the very benefit that you're seeking because your documents are deemed conflicting and thus not valid.
Ohio is one of the last places in the entire country where you cannot change your gender on your birth certificate. Our Ohio State House newsroom reporter Jason Aubrey tells us the ACLU of Ohio is trying to change that.
A federal lawsuit has been filed against the Ohio Department of Health by the ACLU for what they're calling a discriminatory birth certificate policy. Right now, transgender individuals claim the Ohio Department of Health refuses to allow them to change their gender on their birth certificates to reflect the way they identify themselves.
They had stated to me on the phone that they would never correct the gender on my birth certificate under any circumstances.
The ACLU says that's not right and has filed a federal lawsuit.
Ohio's birth certificate policy isn't just an ill-advised outlier, it is unconstitutional.
The group Citizens for Community Values released a statement today that reads in part, "A birth certificate that doesn't accurately reflect the biological realities of an individual becomes a meaningless, if not harmful, document."
This is more than just a piece of paper. This is access to employment, access to jobs.
Liam Gallagher says the policy is also dangerous. Stacey Ray explains how.
I was referred to as the freak, and the female co-worker said that if she ever encountered me in the women's restroom, that she'd beat me up.
ACLU attorneys say it's possible the lawsuit could put legislation currently being worked on at risk, but that's a risk worth taking.
Whatever happens, we're ready to take it on.
Ohio is one of 3 states that do not allow transgendered individuals to change their birth certificates.
The state allows transgender people to update their driver's license, but it leaves them with conflicting identity documents. 2 of the plaintiffs in the lawsuit are Columbus residents who say the issue has affected them in numerous ways, including employment. They say it's also forced them to out themselves to explain the discrepancy in their legal documents.